Welcome to A Healthier, Happier You, the people working to make it happen. I'm Evan J. Cholfin, where we help the brands that help you live healthier. Today, we're joined by Dennis Hanlon, CEO of Soluria and founder of Smilesaver, who's revolutionizing oral device care through scientific innovation. Dennis, welcome.
Thank you, Evan. Nice to see you.
Yeah, great to see you too. I'm curious, what inspired you to dive into Dr. Glass's research at Oklahoma State and create Smilesaver?
I've spent a lot of my career in the scientific community, and I worked for companies that had 5,000 patents. And the bulk of our efforts, most of the time, were developing new products and new technologies based on these patents and new ideas. So the whole concept of commercial development is certainly not foreign to me. A couple of my former PhDs contacted me one day and suggested, along with a biologist friend of theirs, that removable oral appliances that are used globally in the dental industry contain significant amounts of harmful bacteria, and that they had initiated some research to determine if they could take care of that problem in a reasonable way. So I did some research myself, and I uncovered some forensic dentists in the United States that had done quite a bit of work studying bacteria on devices and found not only significant quantities, but a wide variety of what I would consider harmful bacteria.
And how did you assemble the team of dentists and researchers to develop a formula?
Well, there were two PhDs and a biologist and basically myself. In addition, we were able to bring on board a senior executive in science and technology that split her 40 years equally between Unilever and Colgate, Dr. Dion Cummins. And she helped us immensely in the regulatory area and in several other aspects of filing for our patents and making sure that the proper testing was done on the formulation. So one of the things that we can tell people about Smilesaver is that it's been thoroughly tested. And when we say we eliminate 99.9% of harmful bacteria from removable oral appliances, we have the data to show it. And we've also spent quite a bit of money studying the stability of the product and determined that it has a shelf life of 3 years. A lot of work has been done to validate the technology itself, and then we set about in the business world to see if we could validate it with people.
What's the core problem Smilesaver solves that traditional cleaning methods miss?
Well, it's not just eliminating bacteria, but so many of them. We've tested nearly 20 of what the dental community and orthodontic community would consider problem bacteria in the oral cavity. This problem has a continuous string to it because the oral cavity is the entrance to the rest of your body. And since we started this company in 2018, probably see the number of oral care products was a certain number. And since that time, it's gone up by a factor of 3 or 4. But also born during that time was the American Association of Oral Systemic Health, which was really the beginning of the marriage of the dentist and the doctor. Because particularly in the geriatric level, bacteria on devices like dentures, if it's not taken care of, has the capability to migrate to the rest of the body and cause other significant problems. It seemed like a very important need. It was unmet in the way that we made it, and it prompted us to spend money on research, development, market development, and we're real happy with the result.
That's great. So, where are you focusing most of your energy in the business right now?
Direct to consumer. Why? Because the consumer has the problem. So if there's a digital platform out there that attract consumers either in a marketplace platform or in a direct to consumer venue of another type, and we show up there, people see us and we get a very high conversion rate of the product sales. The device makers as well are a target because what happens there is that device makers make a beautiful clear aligner or a retainer, and sometimes they don't always accompany that product with a proper way to clean it. So we're working in that category as well.
That's great. And what's been working particularly well in educating consumers about oral device bacteria?
Podcasts like this one.
Sounds good to me.
I'm pleased to be here because it's an opportunity for me to tell the story directly to a listener. If you look at the number of products that are marketed in oral care, they cover 4 pages on Amazon or Meta or other places. Um, and it's hard for the consumer to differentiate what it is that's important. Naturally, the first one is price, maybe, and availability and easy way to buy it. The technology details, which is what we're talking about here, are equally or more important. As I told you earlier, the claims we make on Smilesaver are upheld to the nth degree. It's very important for the customer to know that he's buying something that works and it works again. So one of the things that's important here is we have done in the validation of the technology to the consumer, we've done very well on conversion rates and we have extremely high repeat buying. Our advertising is pinpoint accurate and it's helped us tell the story in a way that people understand. There's a lot of science here, there's technology here, but it's also gets down to the simplicity of using Smilesaver. It's simple. It's a spray. It's convenient. You can use it anywhere. And in this day and age, the whole idea of convenience and ease of use is paramount.
Yeah, definitely. And who benefits most from Smilesaver's 30-second cleaning solution?
Anybody that's wearing a removable oral appliance, he doesn't have to worry about where he is or when it is. He can remove that appliance, spray it with Smilesaver, and in 30 seconds, the problem solved. It's the fastest, cleanest, with a clean label product in the business.
That's fantastic. You mentioned in terms of advertising with pinpoint accuracy, I'm curious how you're going about that. Maybe you could talk a little bit more.
The advertising's really done in the marketplace stores and on the web. That's principally where we do it. We're not much into the media, although we did quite a bit of advertising in a magazine that 175,000 dentists have access to. The dentists and the orthodontists look at these situations a little bit different than the consumer. Uh, it turns out that it's the simplest thing for us to do is talk directly to you.
What's been your biggest challenge in changing people's cleaning habits?
Getting the information into their hands. This is something different, something new. It has a price point that's a little bit above a common tablet that you drop in a glass of water. So the important thing is the education and making the consumer aware that it exists and why it's important that they use it. That's really what we've focused on these marketing platforms initially. We'll probably do a little bit more direct to consumer advertising down the road.
What's a common mistake you see people making with oral device care?
They don't care for them at all, which has a multiple set of problems because what happens, and this is what the dental community should be concerned about, that if patients don't take care of their devices, they don't wear them. And if they don't wear them, the treatment plan is disrupted. If you're doing a change on a clear aligner every 1 to 2 weeks and you don't wear them, then your program kind of gets out of control. Compliance to treatment plan is exceptionally important. And then there's personal hygiene. We haven't talked about oral hygiene. This bacteria grows very rapidly and it causes issues that most people would rather not have. The device smells, it tastes bad. You don't really want it in your mouth, which is what causes lack of compliance. It offers a real opportunity for people to use this product, Smilesaver, as often as they want. There's no restrictions on use. It's simple to use. So our ability to get the word out is paramount here. And when I say convenience, almost every oral care product in the business requires some level of rinsing and scrubbing. Remove the device, spray it 30 seconds later, put it back in your mouth. Do it 10 times a day if you want. And you'll always have a fresh taste, a clean situation, and no bad breath.
What would you say is the biggest roadblock to wider adoption?
The ability to create the awareness to people of what I'm telling you. It's the biggest roadblock. That requires capital, but it requires smart capital. There's so much money wasted in social media on the belief that if you just put it out there, people will buy it. That's not the case. We all learn the hard way about the pitfalls of social media. It has a lot to do with not only the platforms, but the people that help you manage them and place your advertising. We're getting very good ROAS in our efforts, which tells me that the message comes through loud and clear once it's out there. People understand it and they react positively.
How are you handling the challenge of educating both professionals and consumers?
The key is content. We have we have to be sure we're saying the right things at the right time. The difficulty of that is there's so many things to say. Picking and choosing the appropriate content and language and the claims you make is exceptionally important. The interesting thing about what we're doing here is not only its features and benefits and how well it performs when it's given the opportunity, but there are so many other things for the customer to look at. We're not the lowest price product on the market. We're just the best in class. So you can see there's a multiplicity of buying decisions that take place here um, in a very crowded marketplace.
Yeah, what do you think makes it difficult to stand out in the oral care market?
I often describe this situation that I'm standing in Times Square on New Year's Eve trying to tell everybody about Smilesaver and nobody can hear me. It's to get above the noise, Evan. We're looking at a variety of ways to do it, not just with language, but with proper graphics and different ways of telling the story. I didn't grow up in the dental industry. I grew up in the commercial development of mostly industrial specialty chemical. Very similar process. Everything else is quite a bit different. This is a real problem. Everybody talks about solving it in a different way with sometimes ambiguous claims. If I was a consumer, I'd really be scratching my head to figure out what I should be buying, and that makes our job more difficult. Smilesaver is a definite winner. It does everything we claim that it does, and it fits in to a much broader picture than just a product spraying a device. For example, we are now reaching, and you asked me before, and I neglected to remember this, but we're now reaching deeply into the retail market. Social media and all those various platforms, they're crowded and they can be expensive and you can waste money there. Most retailers, I'm talking about the ones everybody knows, the big box and all that, most of them will tell you that they haven't seen an oral care innovation come along in a long time. Perhaps that's a good channel for us because they look at our product and then they say, wow, that's different. If you go in an oral care line and aisle in any big store, you're looking at toothpaste, toothbrushes, and mouthwash. And they're 30 feet long on each side. There's lots of stuff, but it's all old news. Who's going to be rinsing their mouth with mouthwash when they're in the middle of a football game or wherever they are? The opportunity to tell the story is important because oral hygiene leads to improved oral health. I've already mentioned to you about systemic health, and that's a real problem. AOSH was not born yesterday. It's about 6 or 7 years old, and they're growing and growing and growing because of that theory.
What are your main growth targets for 2025?
Well, I just mentioned retail as one. We happen to be doing very well on the marketplace platforms like Amazon, Walmart, because we're able to tell our story different there. When you get to some of the other platforms, you're really pretty much taking a rifle shot. People come to Amazon and to the marketplaces to buy something. We've got enough validation there and repeat buying that when they give a hint that they're looking for X, Y, or Z, they find us. And when they find us, a huge percentage of them buy the product. That whole thing of awareness and education, the products have registered trademarks, the company is registered. Therefore, we have a nice store and it gives us a platform to tell the story better. And when people see that, they get the information, they buy.
Yeah, well, that definitely makes a difference.
But I think 2025 is, at least in the last half of this year, we hope to make a dent in the retail business. That's difficult because if you look at all the oral care products, and people are concerned about their oral care and their oral hygiene. That's why there's so many products at so many price points and so many price or product formats, because there's a huge market for it. And that market's growing for what I just said. It's a real opportunity. And it's not easy, but by the same token, it's worthwhile.
And which product lines are you most focused on expanding? I understand you have a few.
Well, this product here is Smilesaver. This is 2 ounces. It lasts you about 6 weeks. And we're really focused heavily on this one. But we did create a formulation for people that want to protect their teeth. This is for the sports market. If you look at teeth protection a little bit differently than a cosmetic purpose or cosmetic rationale, like clear aligners, retainers, dentures, people want to look better. They want to have a nice smile. When you're grinding your teeth at night, you're wearing night guards or you're wearing a sleep device, or you're wearing an athletic mouth guard in football or even lacrosse now, they're getting hit in the mouth with the sticks. You want to protect your teeth. Everything you do to protect your teeth, we marketed the solution for that is Guard Health. It's kind of two different avenues we're going down, but the primary emphasis right now is Smilesaver.
What trends in oral health technology excite you the most?
There's a bunch of good ones, but they lack the specifics of simplicity and convenience. About 18 months ago, there was a launch by a company of an ultrasonic cleaner. And I was impressed with it because the ultrasonics in it were high intensity. And if you put something in there that's got biofilm on it or it's dirty or whatever, it really comes out clean. And that's fantastic. But you can't carry it with you. It's a good idea. Probably is a good partner for Smilesaver. When you're not using the device and you're sleeping and you want to soak it, you can do that. And then you carry Smilesaver with you all day and take care of business that way. That was one that was kind of different from a machinery standpoint. A lot of people still use the traditional, simple to use toothbrush and toothpaste or some kind of a mild solution to brush their devices. That's fine, but you're not going to do that away from when you're on the go. Bacteria knows no geography. Wherever you are at any time of the day, you have the problem. 30 seconds later, it's gone. You take a bottle of Smilesaver with you.
What potential challenges in the regulatory landscape are you preparing for?
We're already FDA registered and we make the product in an FDA certified facility. We're fairly decent shape there. We've got all the CGMP coverage that we need in the manufacturing process. But you never know. FDA can make a decision tomorrow. They want to do things differently with these medical devices. We are a class 1 medical device, but I think they have bigger things to worry about than uh, a convenient little bottle of stuff for improving the oral hygiene of the patient. At the end of the day, everybody that has a need or uses products like these, ultimately they're patients. They're either patients or they dove into the cottage industry of people that would make devices with in other ways other than going to the dentist office. But I think that remains a small part of the overall deal. I'm not too worried about regulations.
What's going to be crucial to get right in the next year?
Make sure that the brand has a message and a persona that delivers everything I've just told you. That's a non-stop process. You don't just do it and then you stop doing it. It's a non-stop process, and that's what we do. Spend most of our time on is making sure that the message is ringing true to the customer. If it does, we're going to keep running it. If it slows down, we got to change it. It's always changing. And the biggest, fastest moving change master is TikTok. We're not on that one yet.
Yeah. And there's TikTok Shop as well.
As you can imagine by what I've told you about the kind of the complexity and the crowdedness of the market, there's no time to rest. It's always a fluid situation.
So if we had this conversation again in 12 months, which I hope we do, what would make you feel it's been a successful year?
We'll be selling millions of dollars of this stuff.
Perfect.
Yeah, there's no question. The other thing that we didn't talk about is this is a clean label. Nobody's going to look at that label and run away. There's no preservatives, there's no harmful chemicals, there's no sugar, there's no alcohol. All the green folks, they love these kind of labels. They're clean. Clean labels, the product works, it's easy to carry around, it's portable, and simple and convenient. Oral care needs to drive towards those objectives because, number one, oral care is important. Oral hygiene is even more important. And oral health tops the ladder. Products that fit the definition of people that don't want nasty chemicals in their mouth and actually do the job and are simple and convenient, we hope that's the kind of thing that drives us to what I just told you before, a few $1 million in sales.
I'm sure it'll be great for you.
Yeah.
That's it for today's episode of Healthier, Happier You, the people working to make it happen. A huge thank you to Dennis Hanlon for sharing his insights and the amazing work Smilesaver is doing to help people live healthier, happier lives. If you enjoyed this conversation, make sure to subscribe, leave a review, and share it with someone who could benefit. If your brand or business making an impact in health, wellness, or personal care, we'd love to help you grow. Connect with me at luxhammer.com. Thanks for listening. Until next time, stay healthy, stay happy, and keep making a difference.